Welcome to the Smile Code Podcast. I'm Dr. Isikwadu, and I'm delighted to have you join me once again on our Smile Mastery journey. Today, we're continuing our discussion on sleep and the airway, and I have a special guest in the person of Dr. Jacqueline Patterson, who will shed light and educate us further on this very important topic. I met Dr. Jacqueline in 2023 through the Guiding Leaders Program, an elite leadership program for women dentists offered by Glidewell Lab in Irvine, California. It was a phenomenal experience with a bunch of amazing women dentists. Dr. Patterson is a general dentist and orofacial myofunctional therapist and practices in Las Vegas, Nevada. She specializes in different dental modalities, including but not limited to TMJ, TMD therapy, sleep dentistry and therapy, facial airway growth and development. Her practice, Revive Orofacial Therapy and Wellness Center, was established as a response to her calling to do more for her patients than what traditional dentistry offered. Now, this interview with Dr. Patterson was recorded earlier today, so let's go ahead and take a listen. Enjoy the show. Hello and welcome, everyone, to the Smile Code Podcast. I'm Dr. Isikwadu. And I'm delighted that you're here once more to check in and spend some time with me. Today we have a very special guest in the name of Dr. Jacqueline Patterson, who is going to be talking to us about sleep and the airway. As many of you recall, we've done some episodes on sleep and snoring and touched on sleep apnea slightly in a few podcasts in the past. And so this time we have an expert here who can shed more light on that topic. Dr. Patterson comes to us from Las Vegas. She is a sleep and airway specialist, and she has a center, Revive Oral and
Orofacial
Wellness Center
and Wellness
Center in Las Vegas. So for those of you in that part of the world that want to look her up or check her out, she's there and willing and able to guide you in that area. So very warm welcome to you, Dr. Patterson. Is there anything? You're welcome. Is there anything you'd like to add to that introduction that I missed here?
Oh, no. I mean, yeah, that's my career for sure. Airway-centric dentistry is kind of my passion. I still do restorative general dentistry as well at a different practice. But yeah, airway is kind of my thing. Like that's
is your passion.
Your passion. So it keeps me going.
Right. So is there a point or a story or an event that triggered or sparked this interest in the airway that you can share with us?
Yes. So it was about 2016 and I was in my yes stage. So any opportunity that came my way, I'm like, I'm just going to say yes and see where it takes me. I was very much in that stage. And so I was not really looking for a position. This is before I had my airway practice. I've been an associate for 16 years. And a regional manager from a DSO reached out to me that I had a relationship with, and she said, "Hey, there's an opening at a pediatric office. I know you don't really want to do peds, but check it out." I'm like, sure, I'll go check it out. I'll do a working interview. I'll just see how it is. You never know. So I go to this interview, and they said, "Oh, well, have you met our myologist?" And I said, "I don't even know what a myologist is." So no, I haven't met the myologist, and tell me more. So it was a person. She's an oral myologist. You can also call a myofunctional therapist. And she was seeing an 8-year-old boy and working on tongue posture and breathing and things like that. I'm like, okay, that's interesting. I didn't learn any of this in dental school. And so and then he was in an expander. And I was like, okay, creating more space for the airway, creating more space for the tongue, that all makes sense. And then she said, oh, and then his mom, who was, right there, his mom is also in expansion and also doing myofunctional therapy. And I was like, interesting, adult expansion,
Mm-hmm.
And then so the mom said, yeah, I suffered from chronic migraines, my whole adult life. And this was November 2016. And she said I started doing airway treatments in July, and I have not had one migraine.
Wow.
And that's what sparked me. Okay, I said, okay, I need to learn more about this because
Yes.
it's something I wouldn't think of.
Yes.
And that kind of got me going down the rabbit hole that is sleep and airway and dentistry. And there's a
Wow.
lot. Yeah.
Wow, I'll bet. So you treat in your practice now, are you treating children or
I
both?
treat
Both.
I treat
Mhm.
both. I treat both. I
Okay.
think the youngest I've treated was 2.5.
Oh, wow.
Oldest was in her 80s.
Wow.
So it
Wow.
spans the whole gamut for sure.
Wow. Wow. Can
Mhm.
you shed some light on the success that you've seen with this kind of
Yes.
therapy?
So, I have one patient in particular I like to talk about, and because he's not typical, right? So,
Mhm.
I guess when you think of someone who needs sleep or airway intervention, you might think of someone who's overweight. You might think of someone who's out of shape, sort of like heavy mouth breathing and,
Mhm.
bags under the eyes. That's
Mhm.
sort of the picture that comes to mind, especially in adults. But
Mhm.
this boy, he was 18. He was a senior in high school.
Mhm.
But to me, if you're under 35, you're a child. So, he was a senior in high school. He had sought me out, which I mean, just a senior kid in high school seeking me out because he was doing research and he was like, I'm just really tired during the day. And I feel like I'm just trying to keep myself awake. He was an overachiever. He was about to go to Stanford the next, excuse me, USC the
Mhm.
next semester, and was just like, I read about what you do. I researched you. I think that your treatments can help me because I really think I can focus more if I'm getting better sleep.
Mhm.
So did a home sleep test. He had very, very mild OSA. I think he had I mean, I don't even think you could count it. I think he had like a 4.1 HI. So basically obstruction 4 times an hour every
Mhm.
time he sleeps.
Mhm.
Um, and some doctors won't even treat that, especially he didn't have any other risk factors.
Mhm.
So I put him in an appliance that helped widen and expand his airway. And we
Mhm.
did some myofunctional therapy. And just the results were, I didn't think there would be that much of a difference because to me, he was already sort of
Very mild on the scale of.
very mild, right,
Mhm.
and so, uh, so he I treated him over the summer, and then he went to USC, and then we sort of did a lot of virtual, sessions for myofunctional therapy and kinda monitored his appliance use, and then he sent me a long email with pictures, and the pictures were amazing because before, he was clenching a lot.
Mm.
And, clenching and grinding bruxism, especially when you're sleeping, is kind of an indicator of there's something going on. There's maybe some sort of breathing disorder when you're
Mhm.
sleeping. And
Mhm.
so when he first presented to me, he had a very square face
Mhm.
because these muscles were just working overtime.
Mhm.
And when he sent me the new pictures, I mean, his face was thinner. Like this was thinner. eh, Um, his eyes were brighter, his smile was wider, and he said he had noticed so many differences in his focus. He wasn't tired anymore. And then things that he didn't even know would be attributed to lack of sleep or a smaller airway was he had headaches before. And he's like, I noticed I don't have any more headaches.
Mm.
And I'm just over, and his posture was better
Mm.
because we had done a tongue release referenectomy, and so many things had changed with him. and things that we weren't expecting. And for someone who most people wouldn't even have treated to have such great results, it just
Mhm.
sort of reinvigorated me and said, okay,
Wow.
what I'm doing is
Wow.
a good thing, and it's needed.
Wow, yeah. Well, you know what Emerson said, "Even if one life has breathed
Hmm.
easier than your success." So that's
Yes.
that's that's amazing. That's phenomenal.
Hmm.
And I'm sure you have countless stories like that as well. So how does, like, say, a parent know what are the things that a parent should be watching out for in their
Hmm.
kid who may have a problem with their airway?
So, and I speak from personal experience. I have 3 kids, and
Mhm.
all 3 of them have gone through some sort of sleeper airway intervention. My oldest, my daughter, she's about to be 13. Heaven help me. Um, she never really had any sleep or breathing issues. She just presented with the small. She's class 3 or underbite.
Mhm.
And, so she presented with a smaller upper lower jaw. So with her, lots of expansion, lots of, so there's the anatomical issues, right? If you notice
Mhm.
like an underbite, small jaw, um, even like open mouth posture, if your child is mouth breathing, it's
Mhm.
like this a lot. There's
Mhm.
crowding in the teeth.
Mhm. Mhm.
Um, there's blue or bags underneath the eye, some venous
Mhm.
pooling going on. Um,
Mhm.
your the even the posture, like a forward head posture,
Mhm,
things
mhm,
like that, you can look for. Those
mhm,
are not really in my daughter, but it was the smaller jaw. I knew I had
mhm,
to start expanding her and opening up her airway early.
mhm,
So we started her when she was like 7,
hmm.
in the process, and she's almost 13, and now we're just making everything pretty.
Right,
So,
right,
she's on the tail end. She's about to get into her clear aligner, so she's very excited.
right,
And,
right.
but my middle child, now that was the one. So, um, he I mean, since he was born, he, had a problem, not a problem latching, but it was very difficult to breastfeed him, and
Mhm,
I talked to the lactation, specialist about it, and the lactation specialist wasn't particularly trained in tongue
mm,
ties, but at
mm,
the time, I wasn't either, so I didn't know what to look for. I just know there was a big difference between my first baby and my second baby,
mhm,
and, he was just always really hungry, always
mm,
hungry. It's like he can never. I had a good supply,
mhm,
but it's like he was never satiated, so the, lactation specialist said, "Oh, he's a cluster feeder." And he just wants to eat a lot. I'm like, "I cannot keep up with this kid."
mhm,
So, I ended up supplementing, and breastfeeding, but when I knew what to look for, I mean, he was about 5 when I
mhm,
knew what to look for, and in between, being born in that 5th year, lots of tantrums, lots of very colicky, right? The colicky baby.
mm, mhm.
Um Turned out he had a severe, severe tongue tie, like the tip,
Oh,
like the tip. So basically, he was cluster feeding or never, satisfied because he couldn't latch on
mhm,
well enough and couldn't get enough milk expressed at a time. So
mm,
it seemed like I was breastfeeding a lot, but he just wasn't getting in a lot of milk.
mm,
And so that's a sign for an infant.
mhm,
Like, are they latching well? Are they colicky? Are you having to supplement and you don't really know why? So those are
mhm.
things to look for because that might be a tongue or a lip tie, and
Wow.
which, I mean, I could go on and on, but that, if untreated, that can lead to sleep and airway issues because the
Yes,
tongue isn't able to go up into the roof of the mouth, up into the palate, which helps
right.
as a sort of a natural expander.
Yes,
So the baby will start to grow more narrow. So you
right.
wanna look for that in the baby. So
Yes.
because I didn't, know that or realize that when he was a baby, he wasn't getting good sleep. He was snoring. He was, very emotional and tired and all of the things. And something to look for is bedwetting. So after a certain age, typically kids should be able to sleep through the night without wetting. Everyone's a little different, but
Mhm.
5-year-olds should be able to sleep through the night without bedwetting. He couldn't. Every single night he was
Mhm.
bedwetting.
Mhm.
And it's an indicator of not getting into that deep kind of REM sleep.
Mhm.
And as soon as we released his tie, as soon as we put him in a trainer appliance to help position his tongue and change him from a mouth breather into a nasal breather, the bedwetting stopped. And
Wow.
a lot of parents see that and they're just like, okay, I'm sold, because the bedwetting is just, it's a lot for the child and the
Yes.
parent.
Yes.
And so when we can help correct that just with sleep and breathing, it's sort of
Yes.
amazing.
Yes.
So those are things to look at with
Mhm.
kids,
Mhm.
definitely mouth breathing. And so I do work with a lot of, not a lot, but different organizations, different companies where
Mhm.
we help screen children for these things. And so
Okay.
we're seeing more and more people being aware of
Mhm.
sleep and breathing issues in their kids.
Yes.
And behavioral issues are another thing.
Mhm.
There's a lot of ADHD within the younger population being diagnosed.
Mhm.
And I before and just this is my opinion, but it's also backed up by research. Before you go ahead and just put your child on medication, look at their sleep, look at
Mhm.
their breathing, look at their screen time, look at their nutrition. Because
Yes.
so many times when you change those factors, all of a sudden you don't have the focus and behavioral issues. That was also with my son.
Mm.
When we changed those things, he was tired. And when
Mhm.
you're tired during the day, your brain is like, this isn't the time to sleep. You need to go,
Right.
go, go. So they're
Right.
almost overstimulated because
Right.
their brain is like, no, you can't sleep right now.
Yeah. Yeah.
And, of course you're not going to be focused and things like that. So
Right.
that's part of sort of the questionnaire too, is your child interrupting a lot? Is your
Yes.
child, things like that. So
Yes.
it's a lot of things to look for, but it's one of those things like once you start kind of down this rabbit hole, you can't unsee it.
Right.
So,
Right. Right.
you see it like everywhere now. You're like, oh my gosh.
Yes.
So,
And obviously, when you don't address it and they grow up
mhm,
as
mhm.
adults, I mean, there's health issues.
There's
There's yes.
chronic health
Mhm.
issues because
Mhm.
when um, there's a narrow arch, upper lower arches, and the tongue doesn't have space to be up and forward and
Mhm.
it falls back into the throat. Now you have
Mhm.
an obstruction
Yes.
leading to obstruction sleep apnea. And which, I mean, if your brain and your organs aren't getting adequate oxygen
Mhm.
during the night, I mean, that leads to all types of issues. And people don't die of sleep apnea because they stop breathing at night. They die because of heart disease.
Yes.
They die, your heart is working overtime. They
Mhm.
die because of other chronic issues
Mhm.
that stemmed from their sleep apnea. And
Yes.
so cognitive issues, I mean, your
Yes.
brain needs time to repair. And if you're I have patients who presented their 66 AHI, like 66 times an hour every
Mhm.
night. You're not getting adequate oxygen.
Mhm.
Your oxygen is
Mhm.
going below for at least 10 seconds,
Mhm.
60, like I mean, when is your body repairing?
Yes, absolutely.
So it's really it's a huge health issue. So that's
Yes.
why I love when parents come to me with kids because we can stop this so
Yes.
early.
Yes. It's
And
tremendous.
it's great. Yeah.
Yes, tremendous work you're doing. So, how can people find you?
So, my practice, Revive Orofacial Health and Wellness Center, in Las Vegas. It's a very long website, www.revivehealthandwellnesscenter.com, but you can find me
Right.
there.
Yes.
And I'm also a tooth pillow provider in the state of Nevada. So very proud of that because we're bringing airway treatment, airway interventions to the masses more virtually. It's more accessible.
Mhm.
So Nevada is a very big state, but we're sort of concentrated population in the very south or in the very north, and
Mhm.
little towns in the middle that don't have adequate care all of the
Mhm.
time. And so I have a lot of patients who I'm seeing from these little small towns in Nevada who don't have airway centric dentists, nearby,
Mhm.
but they see something in their kids, he's wetting the bed, or he's just tired all the time, or he's snoring. And we can help them virtually and send them these appliances and help them that way. So
Wow.
toothpillow.com, there's a
Truthfully.
provider in every state.
Mhm.
So if you're here in Nevada, I'd be your person, but we're in
Mhm.
every state now.
Mhm.
And yeah, so those are ways that you can find me for
Mhm.
Airway.
Mhm. And what about other resources? If maybe some dental professionals even are listening in and maybe you want to learn more or do more
Well,
in their
so I know you, Dr. Quadu, from Guiding Leaders, and
Yes.
which is our, great leadership program that Glidewell puts on. And including yourself, but I have so many great relationships that I've formed with different guiding leaders in the groups
Yes.
in the
Yes.
different cohorts, the different years. So
Yes.
Dr. Trudy Reese is from cohort 22, and
Mhm.
she practices here in Vegas.
Mhm.
And she's the reason I even knew about or applied to Guiding Leaders. And Dr. Alvin Scott, who was in our cohort,
Yes. Yes.
um, we got together and we created a business or a venture called Breakaway Global Masterclass. And our focus was, okay, let's create some really great CE experiences for female dentists.
Mhm.
And we were very inspired by the collaboration we saw through the Guiding Leaders program, and like, let's
Mhm.
extend this and do other topics and other subjects. So
Mhm.
eventually I will be doing my own Airway course,
Mhm.
because you call me, you ask me questions, I will give you all of the information. I have no
Mhm.
problem with that. Um, but I think it's time for me to kind of just put it all in one spot.
Mhm.
And
Mhm.
make it more accessible. So I am creating a course for Breakaway, but right now we have courses coming up. One's coming up in October, and it's for dental professionals who are just looking to improve their practices, or
Mhm.
professionals looking to start a practice from scratch. I mean, it's sort of
Mhm.
like starting a practice A to Z, with all of the information, all the systems, all the forms. It's a 3-part series, and our first part is in Napa in October.
Okay.
So you can see us on www.breakawaygm.com.
Okay. Wonderful. That's awesome. For our listeners, sleep is so important. I've touched on this previously. As a last question, Dr. Patterson, do you think, just maybe, if we resolve the sleep issue for everyone in this world, that we would have world peace?
Oh my gosh. If people weren't cranky and
Yes.
unfocused, and
Yes.
yes, I
And
mean,
irritable.
and irritable, and yeah. I mean, that's and I will piggyback that with nutrition.
Yes. Yes.
Yes.
Nutrition and sleep.
And nutrition and sleep. I mean, those things. I mean, that with with my kids, it's getting good sleep and not a ton of sugar.
Yes.
It's
Yes.
and yeah. I mean, it just affects your body so much, and people take
Mhm.
it for granted, and
Mhm.
and sometimes they don't even realize they're sleep deprived until they
Mhm.
really get a good night's sleep,
Yes.
and then
Yes.
they're like, oh my gosh, this is how it could be.
Yes.
Yeah.
We live in a society or a world where we want quick fixes and
Mm-hmm.
we want a drug for every symptom.
Mm-hmm.
And so it's time to maybe take a step back, take a deep
Mm-hmm.
breath, and really look to see
Yes.
what's going on and really make some shifts in lifestyle or habits
Mm-hmm.
or eating. And of course, looking how you sleep, maybe have a sleep study ordered
Yeah.
by your
And
physician.
And sleep studies don't have to be in a lab hooked up to all these machines. I mean,
That's
nowadays
right.
there's lots of different technology that we use, and in my practice, we use a ring. It's like a ring that goes on your finger, and you can do it at home.
Yes.
And it's Bluetooth, and we can get your results and send it to the sleep physician. And so it's a lot easier. So a lot of people don't know that, and so that's a
Right.
barrier. They don't
Yes.
want to go get a sleep test at a lab, and now you don't have to. They're FDA approved and everything like that.
Right.
Um, and then also people think that, oh, well, if I do have sleep apnea, I'm going to have a CPAP. That is not true.
Yes.
There are oral sleep appliances. There are other interventions other than CPAP.
Mm-hmm.
CPAP is the gold standard, but
Mm-hmm.
there's a 70% rate of people who have been diagnosed who have a CPAP that they don't use it. And
Yes.
what's the point if you're not using it?
That's
So,
right.
what I have a lot of patients that, we do ask about sleep with every patient. And they're like, "Oh yeah, I have, but I don't want to wear a CPAP. I don't want to."
Mm-hmm.
I'm like, "Well,
Mm-hmm.
lucky for you, you're at a dental office
Mm-hmm.
and we can create oral sleep appliances for you."
Mm-hmm. Mm-hmm.
So, they don't have to be plugged in. They're not loud. You can take them on vacation. So
Right.
it's there are other options, and I think the more that dentists and physicians are aware of these other options and actually talk more about sleep and talk more about different types of treatments and are educated on it, we can reach more people.
Right. And when these appliances when the airway is expanded and these appliances are in good use, is this a condition that can sort of correct itself? I mean, do people have to be on these
Mhm.
appliances forever?
Right. So that's the different kind of camps that people are in. Some people are just like they're not treating the root cause. Right? Let's
Mhm.
treat your symptoms, which is
Mhm.
fine. I mean, we don't want people to suffer. We don't want people to have these horrible symptoms from sleep apnea. But what's the root cause? Let's try to
Mhm.
get there. And sometimes it's as simple as losing weight. Sometimes patients, when they lose weight, they don't have as much, weight on their airway.
Mhm.
Um, Everything gets a little bit slimmer and they can breathe better. So
Mhm.
sometimes it's just that. I mean, but other times there's a little bit more intervention involved. Sometimes you're tongue tied and
Mhm.
your tongue can't go up and forward. The only
Mhm.
place it can go is in the back of your throat. And
Mhm.
so if we release that tie, if we make your tongue able to go up and forward and do some myofunctional therapy on the tongue to teach it where to go and make sure it's strong enough to stay there, then sometimes that's it. That was the issue. Other times you just had a narrow airway when you were growing and it was never addressed when you were growing. And so if I see you as an adult, there are appliances that we can use that can expand and quote unquote grow an adult airway. It takes time. It's not a quick fix.
Mhm.
But if you don't want to have to be in an appliance for the rest of your life or have to be on a CPAP or do other these interventions forever, it might be something that you want to look into. It
Mhm.
takes a commitment, it takes compliance, but sometimes that's worth it for people to not kind of be tied down to something.
Mhm. Absolutely. Well, wonderful. Anything worthwhile takes time, and
Hmm.
obviously it's an investment in yourself and in your health.
Right.
So, I thank you so much for your time today. You've been so great and so
Thank you,
informative.
AC. This
Yes,
was
it's so
great. I
great.
just love
Yes.
talking to you.
I know. I know, so great. I've been a little bit out of touch, and I was actually gonna have the, make a mention of the guiding leaders at the beginning of my introduction, which I failed to, so I'm glad that that came up. It's a great, group of women that are selected by Glidewell that are put through a leadership program. And if you're a dental professional dentist out there, you're a woman dentist out there looking for more things to do or more leadership training. They put it on every year. They select a
Mhm.
few dentists from around the country, and you can apply and get in and meet some we talk amazing women
Mhm.
in
Mhm.
these cohorts. So thank
And
you.
it and when you're around these people, it you can't help but be uplifted yourself and
Yes,
want to be better. You
yes,
know, and and
yes.
and you see everybody doing things and you're like, "Well, I can do that,"
Mhm.
and now I have the support to do it. So it's yeah,
Yes,
I can't speak
yes.
enough about the program and about you, Dr. AC.
Oh,
Like, I just yeah, I just love you so much, and
thank
I'm
you.
just so grateful that you wanted me on your program, and I'm really proud of you for having this program.
Thank you. Thank you. We all have a little bit of passion
Mhm.
buried somewhere in our mess, and yours is Airway. It's great. Mine is just helping people bring out their authentic greatness and step
Mhm.
into it in a real authentic and peaceful manner. So that's what I'm doing. And I'm glad that you were able to join us. I know we can't keep you here too long because you have to run. But I thank you
These
and
kids
best
always
of
keeping me busy.
yes, best of luck to you. And I wish you the very best. Thank you so much for joining us.
Thank you, AC.
Okay, so we'll see you next time. So this is
Okay.
Dr. AC Quadu signing off from the Smile Code. Remember, get checked if you have questions. Look up Dr. Jacqueline Patterson. She's in the Nevada area, Las Vegas. And remember to sleep well. It's important.
Mhm.
Eat well and keep smiling. We'll see you next time. Goodbye.